Services Committee of May 24th, 2016. Our first issue is regarding the committee, this committee authorizing to fill a vacancy. And I'm going to have, go ahead and speak. Who's going to address this?
I'll move that.
Okay, for discussion purposes. So we have a motion to put on the table. To a second?
Second.
A motion and a second. All those in favor say aye. Opposed? Carried. Now we can discuss.
Okay, basically, the Sheriff's Department got a very well-qualified addictions counselor from my addictions clinic. I'm very glad for them, very sad for us. So I'm here asking to refill that position in our addictions clinic. It's in the budget, and actually there'll probably be some savings because we'll probably be able to hire at step one for that position.
I think we're all in mind it's needed in light of what's going on. Any comments, discussion, questions on the part of the committee? Any questions, comments on the part of the board at large? If not, all those in favor say aye.
Aye.
Opposed? Motion carried. The second issue, they're asking the supervisors to appoint a new member to the Seneca County Community Services Board. Put on the table, you'll have to make the motion.
So moved.
Mr. McGreevy.
Second.
Second. All those in favor? All those in favor say aye.
Aye. The new member is Amy Elias. She actually was a family member. His daughter had a problem with addiction that came and spoke very eloquently at this board meeting not too long ago. She's been coming to community service board meetings and she's asked to be a member. So I'd like to have her on. Her input would be very valuable.
Any comments, questions on the part of the committee? Board? Okay, all those opposed, all those in favor say aye.
Aye.
Opposed, motion carried. I have to have a point of order here, or a point of some direction here, Frank. We make a motion, we second it, to put it on the table for consideration.
Yeah.
Correct.
Yeah.
And then when we discuss it, and then we decide, from based on what we hear, to move ahead with a particular action, then we vote again.
No, you vote for the first time, you vote then. To move and to second is just placing it before the committee. Voting is passing it on to the board.
Right. Okay, so I don't need to take a yes or no vote. Okay, thanks, Brady. The next issue, asking the supervisors to approve an appointment of the vice chair of the Seneca County Community Services Board. Mr. Levine?
Yeah, basically, Howard Schler has been a long-time community service board member, was our vice chair. He was our chair for a long period of time, and he's ready to step down from the community services board, so we have to appoint someone as vice chair of his shoes, and Todd Horton has indicated he would accept it, and the community service board approved him last week.
We have
Motion.
second. Any discussion on the part of the committee? Discussion on the part of the board at large? Not. All those in favor say aye.
Aye.
Opposed? Motion carried. The next issue, Mr. Levine, I guess, is going to be giving us a heroin crisis update. Mr. Levine, what's up now?
Basically, I'm just going to read through you some of the things that have been going on since last I spoke to the board on the heroin and opiate crisis in Seneca County. Since I last spoke to you, the Community Service Board has agreed to undergo Narcan training themselves, and so on June 21st, every member of the Community Service Board in attendance that night will be trained to be able to administer Narcan, which is the opiate overdose reversal drug. So if they come into contact with anybody that they believe might be having an opiate overdose, they're able to administer that. As we just mentioned earlier tonight, just a few minutes ago, Amy Elias, who is the parent of someone with an opiate problem in recovery at this point, will be a board member pending her approval on the 14th from the full board. And she has already been providing us with very good insight into areas that we need to do a better job. So that's a big plus. The Seneca County Addiction Program employees attended a Train the Trainer Narcan training. This will allow them to in turn go out and train other people on how to administer Narcan. So we're just kind of spreading out those multiplication trees that we all loved in school. We're spreading them well. Also, the Seneca County Addictions Program is requesting additional funding from the Office of Alcoholism and Substance Abuse Services, as nearly 50% of our admitted patients have an opioid class diagnoses, and access to detox services has continued to be a barrier for our residents. They can't come into treatment until they've been detoxed, and there is no detox available for them in the county. Cross Hospital recently discontinued the detox services, so we are requesting funding from Oasis in order to integrate what they call an ancillary withdrawal service, or detox, into our regular substance abuse clinic. So that would be an additional service that we would be able to offer, and we're requesting funding from them. The main funding dollars will primarily go to the 8 additional hours in doctor time that we're going to need. We're also asking for Oasis to provide us with funding for a nurse practitioner or an RN to serve as our healthcare coordinator and to assist the doctor with the withdrawal services that we'll be offering. We're also asking for additional support coverage and to ensure our clinic phones are answered after hours. Right now, between 5 and 8, our clinic is open, but we have our phones forwarded to our mental health department. They're very competent in the mental health area, but not necessarily in the addiction side, so we want those phones to be staffed. Once again, additional funding requested from Oasis to fund these positions. We're also requesting funding for creation and filling of a peer specialist position. These services will be reimbursable under Medicaid managed care starting July 1st. And the research has shown that the use of peers is strongly correlated with increased retention of people in treatment. And for those that have left treatment, it's been shown to be correlated with them returning to treatment sooner than they would normally. So we're asking for that. And we're also asking for them to be able to hire for psychiatric time. Since 2013, where we peaked, we had 61.4% of everybody that was admitted into the addictions program had a co-occurring mental health issue. And that number has stayed right around it got low, 51% in 14 and 55% last year. So pretty much a little over half of our patients are coming in with a coexisting psychiatric disorder. We want to be able to offer them psychiatric medications in the clinic that they landed in and not make them have to go across the way. Plus, we don't have the access within the mental health clinic to absorb them. And then finally, 2 more things. The Seneca County Community Services Board Alcohol and Substance Abuse Committee, which is chaired by Dr. Ted Pepperman, will be completing work on the 2016-17 Local Services Plan for Alcohol and Substance Abuse Services, and that'll be finished on the 21st. We will be taking input from providers, families, and this board. Anybody that wants any information or wants to include anything in that plan, please feel free to let me know. This plan guides us as we move forward. It's also viewed by the state when they have additional funds, which this year they do. If our plan indicates consistency with the funding that they have available, then we're more likely to get it. So, and the last thing is the governor, as many of you have probably seen, has been engaged in some heroin forums as a task force. Those are going on across the state, and I'm not sure when the next one is. It might be pretty close to done, but if you get a chance to go to one, it's very enlightening. And that's all I have for the heroin update.
Okay, thank you, Mr. Levine. Committee have any questions, comments? Yes, public or the board at large? Mr. Mazzaro?
Yes, question to you. How is Narcan administered?
Today, what's the most popular method is intranasal. So it's a spray that goes through the nose. The capillaries in the nose absorb it into the bloodstream, so somebody doesn't have to be breathing and they can still have that absorbed in. In some cases, some of the kits have an injection. It's a pen, kind of like an EpiPen, where you'd stick somebody with it. But generally, it's nasal that they're giving out.
A couple questions. Is it considered medication administration?
I guess theoretically you are administering a medicine of some form, but there's no side effects to it, and there's no, I mean, it's benign. The only thing it works to do is to block the receptor site in the brain where opiates land. So if you weren't having an overdose and you got Narcan, nothing would happen to you.
Is there a New York state law that policy and procedure that prescribes how to administer it?
You have to be trained in order to be able to administer it. So, you know, we actually have trained a number of people who are in recovery, in and out of recovery, how to, but obviously if you're having an issue yourself, you're not going to be able to self-administer. But if you're using with other people and one of your peers goes into having a problem, you can administer to them. But yeah, there is a process. You can't just go into a drugstore and say, hey, I want that. You know, you've got to be trained on how to administer it.
Okay, so anyone can be prescribed Narcan?
Anyone can get trained to go and be able to administer Narcan. Yep, they have free trainings down at Willard at the ATC. You can go there. I think it's, I can't remember the days. It was in my presentation, and you can get trained on how to use it.
And how do you purchase Narcan?
You don't have to purchase it. You're given it when you complete the test, when you complete the training.
So if I went to training, they'd give me a box of Narcan or however?
Yep, they'll send it with you. Part of the problem that we're running into now is that so many people are getting trained that there's actually starting to be a shortage of Narcan. So there's some supply issues, so they're actually starting to ramp up supply.
Interesting.
Not that I'm aware of. I'm sure there probably is.
You think as in anything, there'll be stricter and stricter regulations as we go through
On
this?
Narcan? Yeah. No, probably not. It's fairly benign.
Okay.
All things considered.
Okay, thank you. The update.
Mrs. Lorenzetti?
Yeah, trying to think what was. Okay, is the Attorney General, did I not read or hear that the Attorney General is trying to hold insurance companies more accountable as to inpatient stays? Or am I wrong?
No, you're right. Basically, there's a number of things that are happening on the commercial side of the insurance plans. The Attorney General has gone after a couple of plans. I believe MVP was one of them.
Yeah.
It was deep in, I can't remember their managed care contract with, but I think it was them. For defer, deny, deflect.
Exactly. So they're starting to look at it at the state level
Right.
to hold accountable insurance companies for inpatient rehab stay,
Exactly. And part of what
which is what you need to do.
Right, and part of what the state was able to do with the Medicaid product is we're going to manage care Medicaid as of July 1st. The rest of the state, everybody will be managed care for Medicaid. And part of what the state said is that, you know what, you can have all the most wonderful medical necessity policies that you want in the world, but you have to use an approved screening instrument to determine level of care. And you cannot tell someone they have to fail an outpatient before they go to inpatient. If this tool says this person needs inpatient, that's where they go.
Okay.
Yeah.
Thank you.
Any other questions on the part of the board? Okay, thank you, Mr. Levine, for that update. Our final issue, unless there's any unfinished business here, come before us after this. We're asking the committee's being asked to pass a resolution or forward a resolution to the board to allow our mental health department to accept an additional grant from Victim Services. Information was provided. Anything, Scott, anything you want to add to what we have here written?
Basically, they pulled out a cost of living adjustment, I think it was last year, and so we didn't include it in this year's budget, and this year is the 16 to 17, so this will spill over into our next fiscal year. So we have to be allowed to accept additional money. We're getting a cost of living adjustment put back in, which is nice. And they fund quite a bit of our victim services that we provide.
We have a motion to receive.
So moved.
We have a second. Now, any discussion on this? The committee, anybody in the board like to comment? If not, all those in favor say aye.
Aye.
All opposed? Motion carried. Forward to the board. Any unfinished business to come before this committee tonight? If not, this committee stands adjourned.